Okay, so this is skill 35.2, removing a fecal impaction digitally. Sorry. Um, First, you want to, when you enter the room, you want to introduce yourself to the patient, perform hand hygiene, identify the patient using two identifiers. You also want to, or touching the patient, put gloves on, but you want to ask the patient about their normal and current bowel elimination patterns. Ask them, do they normally go twice a day, go every other day? And then this is when you want to do your assessment. You want to put gloves on, you want to get their vital signs, their heart rate, you want to assess their abdomen, you want to listen to bowel sounds in all four quadrants, and then you want to palpate the abdomen for any discomfort or masses. Also, as you're palpating, look at the patient. Look if they grimace or make any facial expressions. Sometimes they may not say they have discomfort, but when you're slowly palpating their abdomen, they may grimace. Ask the patient how they're feeling, ask them their comfort level. And then obviously once you've done your assessment, you want to perform hygiene and let them know that that for this procedure I'm gonna have to go in with my finger into their anus and have to try to soften up that stool and break it apart to be able for it to come out. And if they have any questions, answer their questions. Also, you do want to make sure you have a doctor's order to do this. And then just perform hand hygiene. And then make sure you have all the necessary supplies with you to perform the procedure. Make sure you glove up, and if there is any perineal care or any care that needs to be done before, you can do that. Make sure everything's cleaned up. Make sure you have a bedpan close nearby, and now you're going to keep monitoring the patient, ask them how they're doing. Now we're going to turn them on to their side. Make sure you also provide privacy and lift the bed up to a good working height for you so you're not straining your back. Provide privacy, make sure the door is shut, close the curtains. And once you turn them over, you don't want to completely expose the patient either. You want to cover as much as you can of their body, just exposing the area that you need. What else? So you want to make sure you also have the necessary lubrication that you're going to be using. And then you're just going to explain to the patient that you're going to put your fingers in, you're going to assess around into the anus, into the rectum, and before you do that, you want to lubricate your fingers, your index finger, and your middle finger as well. You may need to use both, but you want to start off with one. Let the patient tell them to take deep breaths, and then you want to insert and kind of move up like towards the umbilicus, the umbilical cord, or not the umbilical cord, I'm sorry, the umbilicus, their belly button, and then you just want to feel for stool, ask the patient how they're doing, if there's any discomfort, continue to monitor the patient. You just want to work that stool and soften it up and try to break it up and remove it. Want to remove it, put it into the bedpan, and also take rests because it is uncomfortable for the patient. And they may experience some sort of discomfort. So just take your time, ask them when they're ready, and then you continue. After that, once you've cleaned out as much as you can, then you want to change your gloves, perform hand hygiene, put new gloves on, clean up perineal area, any pericare needs to be done, clean them up. Also assess the skin, and then you want to have them turn back over, lower the bed. Obviously, you would have changed your gloves, put new ones on if they were soiled, and then lower the bed. And then with the bedpan, you want to assess the stool. You want to assess the color, the consistency, amount, if it's a modern amount, large amount. Once you've done that, if you need, you discard the stool into the toilet, clean the bedpan, and store the bedpan. And then once you lower the bed back down, you perform hand hygiene and put new gloves on. You also want to reassess the patient, reassess the brow sounds, auscultate for brow sounds in all four quadrants. You want to also palpate the abdomen, make sure there's no more, assess for any distension, if they're still having discomfort, palpate for any masses. Also, you want to ask the patient how they're feeling. You want to also retake vital signs. Compare them to when you first started to now, after the procedure. You want to ask the patient how they're doing, make sure they have their call light. Once you've exited the room, you want to document everything. Document your before and after assessment, document the vitals, document what the stool looked like, the consistency, the color, and if there was any change whatsoever in vital signs or assessment, you want to notify the doctor. And always go back and check your patient, make sure they're doing okay. Alrighty, I believe that's it. Oh, one other thing. You also want to educate the patient. You want to educate the patient on some dietary changes that may help prevent an impaction occurring again. Let them know that maybe they need to increase fiber in their diet. There is like powders that you can put into juice or water or whatever that contain fiber, or just educate them on different foods they can include more in their diet. And make sure that they understand that they're able to teach back and they have an understanding, and that they understand that those are necessary dietary changes that they need to make to prevent this from occurring again.